This is a video about fish tuberculosis. What is fish tuberculosis? Fish tuberculosis is a kind of bacterial infection of fish. It's actually a mycobacteria. They kind of think that it's closer to a fungus than an actual bacteria, but it doesn't really matter. The behavior is kind of like bacteria. It looks kind of like a bacteria, behaves sort of like a bacteria. And the symptoms of tuberculosis in fish generally are wasting. Fish that just seem to be starving. They may, at the beginning of the disease progression, they may actually be eating, and then they eat more and more poorly as they lose condition until eventually they just get very scrawny. Their backs may break, the bellies hollow out, muscle mass declines, and the fins erode, and basically the fish just waste away, and so it's been called wasting disease or consumption, even among people that get it. And you might say, wait a minute, do people waste away from fish tuberculosis? And the answer is no. People have their own special tuberculosis. Yay! But you can get fish tuberculosis in little cuts on your hands. So if you're old or your immune system is poor, and you have a cut that makes you vulnerable to tuberculosis getting into it, if fish tuberculosis sets up housekeeping in the wound, it may keep it from healing and actually cause it to stay open and make little granulomata, or little piles of scar tissue like little keloids, and just never heal. So yes, it's transmissible to people, but only weakly so, and only in folks with a weak immune system, and it does cause non-healing wounds in people. All I've ever seen is a picture of that, and it seems to be the same picture everybody studies. It just doesn't seem to be a real widespread problem, which brings me to my next point, and that is that tuberculosis is a widespread problem for fish. It is spread by cannibalism. So when baby fish are coming up in the world and they are eating dying and dead brothers and sisters and cousins and aunts, they may be taking in tuberculosis at a very young age. And so they grow up with fish tuberculosis stored in their tissues, usually in the liver, which is fine because it's been around for pretty much ever in the history of fish. And it doesn't kill very many of the fish unless their own immune system gets suppressed. Here's how that goes. So maybe a really hard winter where the fish are drastically heated, drastically cooled, heated, cooled, heated, like desert falls and winters, which are hot days and frosty nights. Sometimes that's enough stress to allow the TB to come out of remission. Sometimes just a lot of shipping, like if the fish has to be transported from the mountains of Niigata to a wholesaler transshipper and then to an accumulator broker down in Japan, like in Japan, and then flying them to LAX and picking them up, taking them someplace else. And constant handling can weaken a fish, say a koi, to the point where tuberculosis breaks out. Discus get tuberculosis a lot. They have stressful lives, and their environmental conditions are picky. They like a lower pH, and they like water that doesn't move a lot, and they like to be fed constantly, and there's just a lot to them. And without meeting all of their needs, sometimes these fish will break with tuberculosis as well. So if you miss the mark environmentally, or you handle them too much, or they get really sick for a long time, that stress can suppress their immune system and allow the tuberculosis to come out of remission or out of dormancy, at which point it starts to proliferate, which makes granulomas, or little clusters of TB in the intestinal lumen lining, intestinal wall, and then throughout the liver and into other organs, which just reduces the efficiency of all these organs and then causes wasting away. And the fish just get skinnier and skinnier until their backs break, fins erode, overall condition deteriorates, and then somebody picks them off. Tuberculosis in fish is, for all intents and purposes, incurable. There isn't much of anything that kills that organism. The desperate attempt would be to try to improve the condition of the fish so that maybe its own immune system could kick back in and subdue the tuberculosis and confine it to wherever it is at that time. So when folks are going to try to do that, what I'll recommend that they do is switch to feeding at the highest plane of nutrition, whether that's brine shrimp or bloodworms or prime reef or freeze-dried krill or tubifex or live bloodworms in a basket feeder, warming the fish to 80 degrees if appropriate, sometimes warmer because the immune system is more active at a higher temperature. The best water quality that you can provide, and just keep the fish eating, and maybe it tames the TB. Probably not, but for some fish it's certainly worth a try. To diagnose TB under the microscope would be a terminal event for the fish. You have to take some of the liver and then squash it under a cover slip, and then you would be looking for dark clusters of cells in the liver that are actually the granulomas of tuberculosis. They just look like a black ball of grapes or cherries amongst the otherwise normal liver tissue. It's easier to show you than describe. I'll look for a micrograph of tuberculosis in the liver of fish. But when you see a fish wasting away and you do not find intestinal worms, but you do find black orbs in the liver tissue, you're probably looking at tuberculosis. Again, transmitted by cannibalism, largely incurable. It hinges completely on the success or failure of the immune system, which goes to water quality and environmental optimization, and manifests as a wasting away fish. If you have any questions, visit my website. Look for one of the links that says Get Help, and it takes you to a video that explains a few things, and pop me off a question. Thanks.